for heart attack patients. The patients in the hospitals that laid off the nurses saw death rates go up for their heart attack patients because some patients had to wait too long. Now, in addition to the overall cuts to hospitals, Section 3000A of this law awards bonus points to the hospitals that spend the least per senior. Think about it. Not the least per patient, the least per senior. You know, I wouldn't take my dog, my beloved dog, to the vet that spent the least per animal. Why would I take my mother to the hospital that spends the least per senior? We have data in the Annals of Internal Medicine, it was published last year, on all the hospitals in the state of California. And the hospitals in the bottom quintile for spending per senior have substantially higher death rates. What that means is that the seniors in those hospitals who came in with pneumonia, congestive heart failure, cardiac arrest, they had a worse chance of making it home. You know, the experience of growing old has been changed remarkably for the better in this country. I remember when I was a kid, people my grandma's age spent their later years trapped in wheelchairs with crippling arthritis, or they were in nursing homes with congestive heart failure, unable to breathe, unable to get out of bed. Now older people are active, enjoying their later years. What accounts for that? 5 procedures: hip replacements, knee replacements, angioplasty, bypass surgery, cataract surgery. Everybody we know gets those things. It's as routine as getting the oil changed in your car, right? You're not going to be able to get them. This law is going to undo those decades of wonderful progress that have transformed the experience of aging in this country. It's so troubling to see when we have the medical science and the politics is standing between us and more progress, especially for older patients. You know what Congress should have done with this 2,572-page bill? They should have put it in the paper shredder and given us a 20-page bill in plain, honest English. 20 pages. Should have been enough. The framers of the Constitution wrote the entire Constitution, established the entire federal government in just 18 pages. But instead, they're rolling this out. So let me give you a few pointers. This is what I wrote this book, Beating Obamacare, about. A few suggestions on how to avoid the landmines until we can overturn it, right? Number 1, talk to your doctor about keeping 2 sets of books, because your privacy is no longer yours anymore. Under this system, doctors until 2015 earn a bonus for entering all your medical information in an interoperative electronic database. Starting in 2015, they earn a penalty if they don't do it. This database not only collects your information, but it also delivers to the doctor directives on how to treat your conditions. And the doctor has to literally fill in the percentage of each of his patients with each condition based on race and age and all kinds of other demographics, and then show that he or she is following the federal guidelines on how to treat you. Shocking. But we all tell our doctors things we don't want anybody else to know. We confide in our doctors. Well, now if you want to tell your doctor something and you don't want the folks in Washington to know, you have to say to your doctor first, let's just talk between us. Never mind the computer, right? Just us. And no doctor's going to say no, because doctors take a Hippocratic oath. They know the importance of this privacy. It's the cornerstone of really being able to treat a patient. Number two, if you're a baby boomer, line up your doctors now, your cardiologist, your internist, even if you're healthy. Because if you wait till you turn 65 and go on Medicare, you will not be able to find a doctor willing to take you on as a new patient. It's not going to happen. If you know you're going into the hospital, try to cobble together enough money for a private duty nurse, at least for the first night or two, because you can see the standard of care going down. You don't want to wait too long if you need help. So those are a few protective measures. But in the end, we have to get rid of this law. Let me acquaint you with what's happening in Washington right now. The House, the Republican majority in the House, has asked for two extraordinarily modest accommodations in order to agree to fund the federal government with this stopgap funding measure that will last until either November or December. The first is to delay the penalties for people who don't sign up. In other words, delay the mandatory nature of this law for 1 year. They're not saying you can't have Obamacare. Anybody who wants to can go to that website and sign up or have a chat with one of those navigators. I hope you'll ask me about those. But since the employer mandate was chucked, the speaker and others say it's only fair that the individual mandate gets delayed too. The second thing they're asking for is the real stumbling block. They want to eliminate the special perks for members of Congress. Section 1312 of this law says that members of Congress have to enroll in Obamacare, one of those health plans on the exchanges. The thinking back in 2010 was if it's good enough for the public, it ought to be good enough for Congress. But by August, those politicians got cold feet. So they connived with the president, and he weaseled this deal through the Office of Personnel Management, illegally, to guarantee them a subsidy. I say illegally, Joanne, because the president doesn't have the authority by himself to change the law and to appropriate $55 million to cover the cost of this, right? But he decided he was going to do it anyway. He actually took the money out of a fund reserved for poor people who couldn't afford Obamacare. So suddenly, members of Congress who earn base pay $174,000 a year are going to be getting a subsidy that nobody else in America earning $174,000 a year would get. 2 days ago, the Office of Personnel Management sent an email around to members of Congress saying, we want to make it clear, you must choose the gold plan. Don't go for the silver and bronze plans. Those are for the public. Choose the gold plan and we will pay 75%. So, Harry Reid and the Senate Democrats are absolutely adamant that they are not giving up that special perk. And that seems to be the real stumbling block. They've even threatened members of the Senate on the Republican side who tried to push through an amendment attached to the bill to get that subsidy eliminated. It's a disgrace, really. It's a disgrace. And we ought to be speaking up much more about it. It ought to be on the front page of every paper. It ought to be on every radio show. You know, James Madison said in Federalist 57, if there ever comes a time when Congress imposes a law on others and is unwilling to live by it itself, that is the end of freedom. Well, we're seeing it right now. And we've got to stand up and stop it. And then, in 2014, we have to elect Republicans to the United States Senate. We've got a good candidate right here. We've got to elect Republicans to the United States Senate. We have to take the US Senate and weaken this bill. We can't repeal it while Mr. Obama's in office. but we can weaken it substantially. We can get it off the backs of the American people. We have to do that. The stakes are very high. You know, a woman in the United States with breast cancer, diagnosed here with breast cancer, has over a 90% chance of surviving it. In Europe, her chances are less than 80%. That means, do the arithmetic, that means she's twice as likely to die from it. If you're seriously ill, the best place to be is in the United States. A man diagnosed with prostate cancer here, it's not a death sentence. But in Europe, nearly 1 out of every 4 men diagnosed with prostate cancer dies from it. And if someone in your family has what we currently call an incurable illness, this is the nation of hope. This is where the cures are developed. Since 1950, the United States has won more Nobel Prizes in medicine and physiology than the entire rest of the world combined. And that's why overturning this law, it is the fight of our lifetimes. We've got to do it. Thank you.
GrokTV.